said that some Victorian women had ribs removed to fit into corsets. But if you think about Victorian medical science, this is probably not true because at the time this wouldn't have been medically feasible. The surgically removed rib story is one of the many myths about corsets we've all heard before, which has perpetuated the corset's bad reputation as a painful, body-harming device. Looking back at the Victorian era, I can understand where many of these myths came from, but things have changed a bit over the past 200 years. I've done extensive research on the topic to learn more about the effects corsets have on the wearer's body, and whether they are actually as harmful as I've heard them described. Two major areas I've looked into are, number one, the question of whether or not corsets deform the wearer's rib cage, and number two, whether or not corsets restrict the wearer's ability to breathe. First, let's talk about how corsets can affect the rib cage. Can corsets actually deform your rib cage? The answer is yes. It is absolutely true that corsets can alter the shape of your rib cage, but it can only happen through very deliberate waist training. Waist training is the practice of tightening your laces little by little so that you begin to reshape your rib cage and make your waist smaller. But it's a personal choice, and it is completely up to you rather than society. In the Victorian era, corsets were a symbol of high social status and were always worn tight-laced. Victorian women had no choice but to wear their corsets uncomfortably tight in such a way that their rib cages would adapt to accommodate the corset, resulting in deformed rib cages. However, since corsets are now a personal fashion choice rather than a social necessity, wearers have the freedom to decide how tight they want their laces and whether or not they want to waist train. Another thing is that corset wearers learned you don't have to wear them so high on your abdomen. Kim Reiser explains in a small part of her web article called Myth Number 3, Corsets Are Bad for Your Health, that, quote, corsets do not compress the ribs and instead focus on the fleshy waist area between the ribs and hips. Anyone you ask about placement will recommend that you adjust your corset so that the narrowest part is between your floating ribs and your hip bones. Placing the corset too high is not deadly, but can result in unnecessary discomfort. So to wrap this section up, yes, corsets can reshape your rib cage, but it has to be done intentionally. Doing it accidentally is almost impossible because waist training is a gradual process, and trying to do it too quickly could result in injury. Waist training is also completely optional. This is not the Victorian era, and no one's going to make you wear your corset any tighter than you want it to be. Next, let's talk about how corsets affect your breathing. Can corsets hinder your ability to breathe? Yes, they can if you're lacing too tight or wearing one that's too small. Too tight laces or a too small corset can prevent you from taking a deep breath, which can make you feel like you're suffocating and may amplify the effects you feel. Looking back in the Victorian era, it's no wonder women fainted so often. Other than overheating, I imagine their corsets had a lot to do with it because they were wearing them entirely too tight. A corset that is too tight will restrict your breathing and even your flow of blood, meaning your body isn't getting enough oxygen where it needs it. That's enough to make you pass out. However, buying the right size and pulling your laces comfortably tight will have no such effect. Even if you're not waist training, you have to wear corsets loosely and allow your body to adjust to the feeling of being encased, but it doesn't take long and it isn't uncomfortable. Lucy from Lucy's Corsetry dedicated an entire page on her website to explaining the physical benefits of wearing a corset. Interestingly enough, she cites that 2 women have contacted her to explain that corsets have improved their asthma. Now, I don't recommend wearing a corset to cure asthma. That's something between you and your doctor. But what happened with these 2 women was that by wearing a corset, their posture was improved and that opened their airways. Because think about it, when you slump, your spine is curved unnaturally, your chest is caved in more than it should be, and that's enough to affect your airways, if only a little. Standing up straight straightens the spine and airways, making it just a tiny bit easier to breathe. And corsets, by the way, will make you stand up straight. There's no way to effectively slump in a corset. So my point is that, yes, a corset can hinder your breathing, unless you wear it wisely and don't put your body under the stress of being laced up too tight too soon. Before I close, I would like to share a few completely true benefits and risks of wearing a corset. These facts were found on Lucy's Corsetry, on a combination of her physical benefits of wearing a corset webpage and one of her FAQ pages called Do Corsets Carry Any Health Risks? Let's start with the good things. Number 1 is that corsets can help with back pain in exactly the same manner as a back brace. Number 2 is that they can reduce menstrual cramps in women, which seems strange, but it's the same concept as wrapping an injury tight and reducing the pain with pressure. Number 3, they can be a weight loss aid. Not a weight loss method, but an aid. By wearing a corset, you can look at yourself in the mirror and see yourself as thinner, which helps you envision the end result of a diet. Do not use corsets as a diet, though. They can reduce your waist, yes, but they're not meant to replace healthy habits like eating well and exercising and breathing. So now let's look at a few risks. Raised blood pressure is one. Corsets can be worn for 6 to 8 hours safely, but remember that any longer could put your body under stress, which can raise your blood pressure. You need to take corset wearing in healthy doses and avoid stressing your body. Number 2 is headaches. Wearing a corset too long or wearing one with laces too tight can cause a headache, whether from stress or restricting your blood flow. Number 3 is acid reflux. The reason behind this is not exactly known, but it has happened, and it happens often enough that it warrants a warning. If you have acid reflux, then it will either reduce it or amplify it, because both possibilities have been reported before. So, are corsets dangerous? They absolutely can be, but as with anything, if you know how to use one, then the risks are few. We no longer live in the 19th century where women were forced to wear tight corsets all day long. Today, corsets are a choice, and you can choose to wear them safely. You don't have to reshape your ribcage, and you don't have to have difficulty breathing. These are literally a thing of the past. My call of action for you today is that you don't judge things by outdated standards. Corsets have a history of being unsafe, but the thing about history is that it's come and gone and times have changed. Ladies, you don't have to be uncomfortable in a corset, and if you are, then I would advise you to find out why and see what you can do about it. Gentlemen, the lady in your life doesn't have to risk her health to wear that corset, but if she is, let her know to look into it. Thank you all for coming to listen today. I hope you have a good afternoon and feel more confident in the knowledge that corsets are not dangerous, usually.